Hello, everyone, and thank you for joining us today. I'm Jami Snyder, President and CEO of JSN Strategies and the former Medicaid Director in Arizona and Texas. I'm excited to be returning as host for this episode of Beyond the Script. Today, we will talk with two prime MRX experts about the growing challenge of effectively managing medications administered by healthcare providers in a clinic setting. Our guests will discuss a solution that promotes appropriate use of the lowest cost physician administered drugs or PADs. With that, I will introduce today's guests. First, we have Ann Walker, VP of Business Development, State Government Solutions for Prime MRX. Good to see you, Ann.
Thank you, Jami. Good to be here.
And we also have Tina Hawkins, PharmD VP of Account Management. Thank you for joining us, Tina.
Hello, Jami. I'm pleased to be here today.
Prime RX is known for its enduring innovation in the Medicaid fee-for-service space. As we explore its PAD Advisor offering, we encourage you all to join the conversation and submit your questions in the chat. We will get to as many as we can at the end of our conversation. But first, we'll hear from Ann and Tina. Ann, could you provide a little bit of background about yourself and tell us about your history with Prime RX?
Absolutely. Thank you, Jami. I've been with Prime MRX for 6 years, and before that with CVS Health, focusing on pharmacy benefit management and retail pharmacy issues. I've also worked with several healthcare provider groups in the Washington, D.C. area, representing their interests before Congress and the executive branch. And I have over 20 years of government-related experience. And in this role, I focus on growth initiatives that take into account government affairs trends to solve for the needs of Medicaid departments and the beneficiaries they serve.
And Tina, can you provide us with a little bit of your background as well?
Absolutely, Jami. I have spent the past 17 or so years at Prime Magellan RX, providing our services and solutions to the Medicaid programs and members we serve. I spent several years focusing on clinical policy and preferred drug list development and maintenance. But in the past 10 years or so, I have been able to transition to more of an operational focus. Currently, I lead account management teams for 8 of our Medicaid clients. This allows me to work in both the clinical and the operations aspect of the business, marrying both skill sets to further develop solutions for our Medicaid customers. It has truly been an honor to serve our state Medicaid customers and the members that we serve across the country.
Tina, you and Ann really bring a unique blend of experience together to move this important work forward. Let's get right into why Prime RX created the PAD Advisor program and what it really accomplishes for state Medicaid programs. We'll start with Ann.
Yes, of course. This is an interesting product for our state Medicaid fee-for-service clients because it will help them determine which Medicaid covered outpatient drug that is administered in the physician or clinic setting is the lowest cost to the state. And it helps states build utilization management strategies around these lower cost, clinically appropriate medications. As more medications are administered by practitioners in a clinic setting versus being dispensed by the pharmacy, effectively managing these medications, which can be expensive for Medicaid programs and members, is a growing challenge, and this product seeks to alleviate that challenge. So by way of background, in Medicaid, a manufacturer enters into a rebate agreement with the Secretary of HHS if they want their drug covered in Medicaid. This requires manufacturers to guarantee that states get the best price by offering rebates to states for their products. States share a portion of that with the federal government. And of course, manufacturers also have to agree to participate in a couple of other federal programs serving vulnerable populations. But with that, Medicaid covers almost all the manufacturer's FDA-approved drugs. This occurs for both drugs dispensed at the pharmacy and those dispensed in the clinic setting. Medicaid programs need to know which medications are least costly, net of rebates, as well as by site of service, and apply utilization management tools to drive utilization to the lowest cost, clinically appropriate option for a given disease state. This is where the product PAD Advisor comes in.
From your perspective, what value does PAD Advisor bring to the states?
This product allows our state Medicaid agencies to apply similar utilization management strategies around physician-administered drugs as they apply to the medications that are billed through point of sale. PAD Advisor gives states tools to know which PAD is least costly by site of service and net of rebates, and provides the ability to apply appropriate utilization management measures. This industry-leading solution meets the unique needs of our state Medicaid agencies by identifying the most cost-effective physician-administered drugs, net of rebates, and based on the state's specific provider reimbursement policy, giving a state the tools they need to decide what benefit, whether it be pharmacy or medical, they want to manage a physician-administered drug within. We perform financial impact analyses, taking into account the state's specific provider reimbursement, along with rebate amounts to calculate the lowest cost for clinically appropriate PADs in a specific therapeutic class or for a specific disease state. This analysis also takes into account how potential market shifts and utilization management strategies will impact overall net spend for our clients and how the cost to the state changes based on the site of service. Then we work with our clients to develop and implement utilization management strategies to drive utilization to the clinically appropriate physician-administered drugs with the lowest net cost. We also provide a fee schedule, including common physician-administered drugs for the medical claims processor to use in paying claims. This fee schedule helps ensure providers are reimbursed appropriately. We include prior authorization adjudication, which is performed by our clinical pharmacy experts, and we provide project management for up to 6 months to ensure a smooth implementation. We also provide high-touch account management team that leverages experts in the state's specific programs who are also well-versed in physician-administered drug management and its challenges.
For that explanation of how a Prime MRX is really partnering with states to control costs around physician-administered drugs. As you mentioned, Ann, there's really a sense of urgency for Medicaid programs right now. Now that more medications are given in the clinic setting, states continue to be challenged by effectively managing these medications in the least costly way. So let's dig a little bit deeper, and then we'll get to questions we've received from our viewers. There is, by the way, still time to submit questions in the chat, and we welcome all of your questions. So after hearing about the current landscape and opportunity at hand, let's take a closer look at the importance of supportive clinical policies in managing PADs. Tina, can you please share your thoughts?
Absolutely. We heard from our clients that state agencies were struggling to develop robust utilization management strategies for medications administered under the medical benefit. They have these robust programs for drugs administered under the pharmacy benefit, but really needed similar programs for PADs. Our solution leverages Prime and Magellan Rx's decades of clinical expertise to develop similar utilization management strategies for these medications, helping our states better manage the utilization and ensuring that their Medicaid members get the right drug at the right time for the right disease state. Our team of pharmacy experts do the research necessary to inform clinical policy decision-making. We provide an overview of the medication compared to other medications in the same therapeutic class or to treat the same disease state. This overview is then used to develop the necessary utilization management strategies to ensure that the appropriate medication is provided to the member. These strategies that can then be tailored based on the state's own legislative and regulatory policies. We can also leverage state-specific specialist support from members of the state's own Pharmacy and Therapeutics Committee or DUR board to further refine the utilization management measures for each state's unique needs. We also use our clinical experts to perform prior authorization adjudication to help enforce the strategies adopted by the state. If needed, we also have access to disease state specialists to support prior authorization determinations.
I think state officials will be thrilled to hear that this solution is really a solution that can be tailored to meet the needs of states. This level of utilization management support is really a boon for states. And can you speak to where rebates factor in rather to PAD management?
Thanks, Jami. Actually, similar to how states Medicaid programs can invoice for rebates associated with Medicaid covered outpatient drugs, dispensed in the pharmacy setting, states can also invoice manufacturers for rebates associated with covered outpatient drugs dispensed in the physician's office or clinic setting. However, in Medicaid fee-for-service, states often have separate processes and teams managing pharmacy claims and medical claims, where each of these are billed respectively, and they don't always understand the details around how Medicaid rebates apply to drugs dispensed at the pharmacy setting versus the clinic setting. And that's where our team comes in and provides expertise to states around the Medicaid drug rebate program as it applies to all prescription drugs dispensed in the Medicaid program, regardless of setting. And we help states understand what provider administered drugs actually cost the state net of rebates. Medicaid reimbursement under the pharmacy benefit is usually based on AAC or NADAC reimbursement rates. And under the medical benefit, the payment is usually ASP based. States were struggling with how to apply rebate and determine net cost of medications administered under the medical benefit because it has to take into account a different reimbursement model. We use our pricing strategy experts and deep understanding of Medicaid rebates to provide states with the net cost of medications when administered under the medical benefit so that states truly understand the cost of these medications.
Much to you both. We'll now take some questions from our viewers. And to the viewing audience, please keep sending your questions our way. We'll try to answer as many as we can in the next 5 minutes or so. So we have a question right out of the gate. How are utilization management strategies managed through PAD Advisor? And Tina, do you want to take that one?
Sure. Utilization management, first of all, thank you for the question, but utilization management strategies are very similar under PAD Advisor as what we see through point of sale or through our pharmacy benefit. So we would develop clinical policies that are very similar with utilization management strategies that are very similar. And then we actually administer those utilization policies or the prior authorizations through our channel and then communicate that back to the medical claims processor. So we'll build an interface between us and the medical claims processor so they know which physician administered drugs that PA has been approved for, and then they can process claims against that.
Fantastic. Again, just really demonstrating how this solution offers a tool for states and how you partner with states. I'll go to you, Anne. How does PAD Advisor remove barriers for states grappling with the use, cost, and reimbursement management of PADs?
This is really about giving states information so they can manage their program efficiently for the beneficiaries they serve. PAD Advisor gives states insight into the cost of these drugs and gives states the tools to manage to the lowest cost, clinically effective drug net of rebate. So we want to provide states with tools and information to manage their Medicaid programs effectively and in turn, best care for their beneficiaries. That's really what this is about.
Fantastic. So we'll go with one more question before we wrap. Will the Inflation Reduction Act, which gives Medicare the power to negotiate prescription drug prices directly with drug companies, have a positive impact on Medicaid budgets as well?
That's a great question. Actually, I'll take that one. Medicaid is largely unaffected by the IRA, the Inflation Reduction Act. Medicaid federal rebates are set in statute already and include a CPI adjustment if manufacturers increase the price faster than inflation. The Inflation Reduction Act gives the federal government the authority to negotiate rebates for Medicare, as you said, Medicare Part D drugs, and eventually Medicare Part B drugs, and also includes the CPI adjustment if manufacturers increase the price of the drug faster than inflation. But Medicaid is largely unaffected. However, the Congressional Budget Office did flag that Medicaid could be affected by the IRA if manufacturers choose to increase launch prices of new drugs and subsequently then have a lower CPI adjustment over time. If this occurs, then Medicaid federal rebates could be lower over time, but that remains to be seen.
Really helpful. Thanks so much, Anne. So before we wrap, I just want to give each of you an opportunity to offer a few parting sentiments. Tina, we'll start with you.
Sure, thank you. So PAD Advisor is geared towards meeting an unmet need for our clients. We are focusing on working within our clients' unique needs to develop utilization management strategies and to truly understand what these medications cost our states net of rebates. PAD Advisor is the next inline product innovation we have brought to market in the fee-for-service Medicaid space, layered on top of our 24 years of preferred drug list management experience. Ann, I'll take this and just say, if anybody wants to learn more about Pad Advisor and how it can be implemented for your program, please reach out to us and let us know.
Absolutely. Yes, we built this product really for our Medicaid fee-for-service clients to help them manage these high-cost drugs dispensed in the clinic setting. This product will help state Medicaid fee-for-service programs know which physician-administered drug is lowest cost net of rebates so that they can build strategies around those and drive utilization to the lowest cost clinically appropriate agent. Prime MRX is committed to innovating for Medicaid fee-for-service and building programs and products that truly reimagine pharmacy management to provide the same care we want for our loved ones.
Wonderful. Thank you to Ann and Tina for joining me today for Beyond the Script. And thank all of you for joining us. A replay of this will be available on YouTube, and a reminder to watch our LinkedIn page for an announcement of our next episode. Have a great day, everyone.
Thank you.